everybody, this is Dr. Mo from Mo Body Works. I am here with my super awesome acupuncturist, Justin. We're going to do just a really quick little blurb on carpal tunnel. So carpal tunnel is traditionally thought of as being a median nerve issue. You have a bunch of carpal bones in here, 8 little tiny bones that cause sort of a bit of an arch and tunnel that the median nerve goes through. So I do see carpal tunnel misdiagnosed a lot. People will consider carpal tunnel kind of anything. I hear anything from thumb pain to elbow pain to any kind of forearm pain, anything with the hand. People will either self-diagnose or have been inappropriately diagnosed as being carpal tunnel. There are some pretty invasive procedures for carpal tunnel. Surgical procedures, which do sometimes work and are sometimes necessary, but if misdiagnosed, they don't fix it. And it's always best to start with conservative approaches because surgery is always with some potential risks, including infections, failed surgery, etc. So we don't want to say anything negative about our orthopedist friends. It's just that conservative treatment should always be tried prior to surgery. So as a chiropractor, I work on carpal tunnel a lot. Probably on a daily basis, I am working on hand, wrist, elbow pain, and even people who really do honestly have true carpal tunnel issues. A lot of cases can be completely cured or stabilized with chiropractic. What I like to do initially is just assess the hand. I like to make sure that each one of these little bones in here and the joint complexes are motioning correctly. I just go through everything, make sure it's working. And then just look at basic hand function, even like checking out each finger to make sure that they're all motioning correctly. I like to look at the thumb, making sure everything in here is moving the way I like it, make sure there's no obvious inflammation or restriction. I also like to look at lateral motion, just moving the wrist back and forth. And then I always move my way up. I like to look at radial head motion. I like to look at the entire elbow, making sure everything's moving, there's no restrictions in here. I found so many cases where people are having wrist pain, but really it's referred pain from an elbow that isn't able to move within its correct ranges of motion. From there, I like to look at tissue, see if there's any obvious tissue restriction in here. And then I work my way up looking at biceps, triceps, and anterior, middle, posterior delt function. AC joints also can cause pain all the way down the entire arm, as anything doing with the AC joint or shoulder joint in general can cause inflammation with these nerves that come out of your neck and form the entire innervation system for your arm, hand, finger, everything. I like to look everything in here, and then I always check people's neck and jawline additionally. So if you know anyone that's having carpal tunnel and is looking for someone that works extensively on hands and wrists, we definitely do that. Justin works a ton of it with acupuncture.
This is really good for pain relief, helps with the numbness. It doesn't really matter what the condition is. Acupuncture is going to be really good for restoring circulation to help those tissues heal.
That's it. Have an awesome day.